Dr. B, do you feel that it is important for a patient to take a holistic functional medicine approach when it comes to addressing menstrual cycles and hormones just in general?
Well, it just definitely depends on the person, but in general, the more we can go that way, the better, because of the implications that we'll have on whole body and future health, and even health as related to when someone may get ready to have kids coming in the future. And I'll tell you about this patient that I saw recently, and will continue seeing, who really demonstrates, this point. So this was a young woman who was 20, and she came in telling me that she was really worried that she had PCOS and that she had talked with her other doctor about it and hadn't really had any labs done and didn't feel like she had answers to that question, and she wanted to proceed with a further discussion and workup. So she told me that her cycle was 30 to 40 days. She'd started her period when she was 12, and that ever since then it had just really hurt a lot, especially when she started bleeding. She would have to use heating pads, put castor oil. It was hard to move around and would really put her down for like 2 to 3 days of her cycle. And while she knows this happens to people, she doesn't expect that it's actually indicating that her body is in great health. She knew that it was a marker to dig deeper, which is very true. Breakouts on her skin had been bothering her for the last few years. She'd seen a dermatologist, was given an antibiotic that she felt like really messed up her system for a few years after that. And that's not always the case. Some people have great responses to those kinds of treatments, but for this particular patient, shortly following that, she got strep throat multiple times, a lot of yeast infections. Then she had mono on top of everything. And then unfortunately, she had Clostridium difficile, or C. diff, which is an infection that happens in the intestines that can come from killing beneficial bacteria with multiple rounds of recurrent antibiotics. And it took a long time to get better. So she was just kind of coming out of the fog from a couple of years of dealing with that. And she really wanted to try to figure out how to more whole body approach her symptoms of PMS irritability, crying, breast sensitivity before her cycle, breakouts, and then just the really significant pain that she was having. So when I talked to her, I said, well, it really sounds less like PCOS and more like you have a inflammatory dysmenorrhea situation, but let's do some evaluation and look into things. So we did some blood work and we did an ultrasound. She really wanted to take a pretty basic approach at first. She's young, she wasn't ready to dive into a gigantic workup, but we did enough so that I could give her more information on what to do. We did an ultrasound and a physical exam, which was normal. Her ovaries did not have a polycystic appearance, which is helpful to know. We saw beautiful corpus luteum, which tells us she's ovulating, or she had just ovulated. That's a cyst that ovaries make when you ovulate. We went over her labs in thorough, and the things that tell us about PCO were actually normal. She had a normal anti-Müllerian hormone, her testosterone was normal, she did not have a high luteinizing hormone. However, she did have some other important findings. Her LDL cholesterol was quite high, her B9 was low, her zinc was low, her omegas levels had a very inflammatory pattern, her vitamin D was low, her magnesium was low, all outside of the reference range of the lab. And we had done some other nutritional evaluations through routine blood work as well. So when I talked to her, of course, as a gynecologist, I'm going to offer her what would probably make her feel better symptomatically very, very quickly. For breakouts, painful cycles, PMS, a lot of times using a birth control pill like Yaz or Yasmin can really improve symptoms and fully support patients that want to do that. The downside of birth control pills being is that they increase sex hormone binding globulin, which binds up free testosterone in the body, and that can last a really long time for women and sometimes be irreversible and be annoying or problematic. She didn't want to go on any kind of contraception anyway, but of course we did go over that option. I also offered her supporting her luteal phase with progesterone in case that it would help her pain, which she also didn't want to do. She really just wanted to focus on nutrition, and gut health, which I agree that is an excellent path to take and many times will improve these types of symptoms. And rather than squash the symptoms with a blanket and pretend that everything went away, being able to support the body nutritionally and resolve the inflammatory situation that's causing the expression of these menstrual symptoms, because it's going to impact whole body health, as well as acknowledge that she had a lot of risk factors for microbiome disruption and intestinal permeability issues that she wanted to work on addressing. So we had a very detailed discussion about her nutrition. I used one of our Institute of Functional Medicine nutrition plans called the Detox Food Plan because it really emphasizes certain phytonutrients that help with liver pathways that affect hormone metabolism. We talked a lot about protein and fiber and how important those were, as well as low glycemic and keeping the blood sugar stable and how that impacts hormones. We talked about intestinal permeability and options for testing. She's not doing that right now, but she probably will in the near future. So sometimes we can make what we call empiric best guesses about what to do. Even if we don't have data, we don't have objective data, we use our clinical best guesses. So because of her history, I'm going to presume that she needs some intestinal permeability support and different types of microbiome support. So we talked about that and I gave her instructions to work on that. We talked a lot about how omegas, fatty acids, including your levels and ratios of EPA and DHA, really modulate the prostaglandin pathway, and that prostaglandins are inflammatory molecules that make the uterus hurt really bad. So that's always involved with painful cycles and painful uterus. And so she was going to work really hard with both supplements and nutrition to correct her omega levels and work towards a ratio of those levels that support less inflammatory prostaglandin production rather than more. She was going to replace her zinc and her vitamin D, as well as vitamin A and magnesium, and also work on using foods that were highly supportive of that. And we talked about other nutrients that would probably be useful to her, such as boswellia, bromelain, DIM. So she has some options to use moving forward as we work through this process.